Walk us through, we've talked about the PRP treatment. Can you walk us through a bone marrow treatment? Bone marrow
Yeah,
concentrate?
sure. So bone marrow adds a level. So when I do bone marrow concentrate, I always add PRP to it. And the reason is that probably about 5 or 6 years ago, I did a little sample study. Didn't publish it. This was just for my own information with the device manufacturer I was using. Because I was curious. It's very important when you're trying to heal tissue. You need this, we call it the regenerative triangle, okay? You need progenitor cells, stem cells, we like to call them progenitor cells. You need a growth factor, okay, signaling protein, and you need a matrix or a scaffold. Without all three, things don't want to heal. So I was curious, we're doing bone marrow concentrate. Obviously, it's red. There's red blood cells in there. But how many platelets are actually in it? Because I need platelets. I need growth factor. So I had about 20 samples we sent, various age, various sexes, and it turned out that there was a huge variety, anywhere from about 1.5 times baseline to 10 times baseline platelet concentration in their bone marrow. So one of my questions that I asked myself was, okay, do some of these people not respond as well because I'm not giving them enough platelets? Well, the device we use allows us to do a spin, let's say, of peripheral blood for platelets before we draw the bone marrow concentrate, or after for that matter. So we can do 2 spins. So in that case, what I can do is sort of cheat. And it's not going to hurt somebody to have too many platelets, but I can make sure they have enough platelets. So if you come in for bone marrow concentrate treatment, first we draw your blood. We put it in the device in order to concentrate your platelets. While that's spinning and doing its deal, gown, glove, lay you on your side. Some practitioners lay people on their belly. I like the side. Because it's just a little more comfortable for people. I use the ultrasound, or you can use real-time x-ray, but I like the ultrasound. There's a certain sweet spot on the pelvis. So when I say pelvis, we're talking here.
Kind of the side of the ASIS, or
right?
you're in
PSIS.
the PSIS.
So PSIS, posterior superior iliac spine. So it's your pelvis. It's not your hip. It's not your spine. It's that big bony thing between. And you can use the ultrasound to determine the sweet spot on the pelvis that you can draw from where no ligament, no muscle attaches to decrease pain. Because we know that when you say bone marrow aspirate, people freak out. But if you do it right, it's not very painful. So I find that spot, then I sterilely prep, drape, put all my fun, nice clothes on, and I use a little bit of numbing agent, numb up a nice quarter-sized area with a tiny needle so it's not very painful at all. So I'm just numbing the bone. And if that bone gets numb, the patient doesn't feel the needle go in at all. Then I'll put the bone marrow needle into the skin, into the bone. Patients don't feel it. What patients do feel is when you remove, so we call it a trocar that you take bone marrow out. It's basically like a straw with a needle on the inside. So you take the needle out. Now when you do that, there's a pressure change. So what you feel in bone marrow with the discomfort is that pressure change. So if I remove it really slowly, patients usually don't mind. Now, a lot of people, if I just say needle, they're going to be like in the next state. So for people who just the whole idea is too much for them, we pre-treat, too much for them. I'll pre-treat with a little bit of benzodiazepine, like a little oral anxiety med, a little oral sedation. If they're really nervous, we can use some nitrous oxide. But by no means, most people don't need that. Amazingly few and far between. Between the local anesthetic, putting it in the right spot, going slow enough to begin with, talking the patient through it, they do fine. It takes about 1.5 minutes to pull out the bone marrow. Once the bone marrow's out, put a bandage on that area, and then we process the bone marrow in that same device. Once that's processed, then we go back through with the injection using the ultrasound.
So is there any concern as some patients, though, you're taking something out? What's that look like from it regenerating within the body? Is there any deteriorating effects from taking marrow out of that spot?
Well, it's interesting. There's not been any studies on the amount of marrow that we take. So we take a very small amount, 60 cc's, 100 cc's of bone marrow. For example, when somebody does a bone marrow transplant, they're taking thousands of cc's, okay? Those individuals need to be in the hospital for a few days, IV fluids. The studies have shown that it takes about 90 days to replace that concentration. So we're taking a teeny tiny amount. Now, on every patient that comes in, lab work would include a complete blood count. And the reason you want to do a complete blood count is to make sure that the patient has enough platelets, they have enough red blood cells. So let's say someone comes in, they didn't know that they had leukemia, right? that's happened where all of a sudden I get a CBC or a complete blood count, which is a lab test, and you find somebody who would never have responded to this, nor do you want to treat because they had an underlying problem they didn't even know about. So yeah, in a normal person, it's about 90 days. And there's plenty of, remember, I'm taking a little bit out of one bone. There's the other side of the pelvis. There's the front of the pelvis. There's all your long arm. So you're not going to miss it.